Latest number of positive cases today is recorded at 2,272. That means we've got 99 new cases recorded. So that's the latest total, 2,272, with new 99 recorded for today. Regrettably, we have also recorded 2 deaths that we are now able to confirm at this point. One from the Western Cape, and a male who's 68-year-old who came in acute respiratory distress and hypoxia with underlying concomitant diseases of diabetes, hypertension, and chronic renal disease. And this has been the pattern for most of the people that we have seen, where there is some underlying ailment, as it were. But the one in Gauteng is the one that's raising quite a bit of concern to me. Is a 57-year-old male who has been was admitted in acute respiratory distress, was taken ultimately to ICU, and then his chest X-ray showed some changes which were suggestive of COVID and, of course, COVID-19, and was confirmed to be positive. And whilst in the ICU, his condition took the turn to the worst, and unfortunately, we lost him. We do not have the record of any of the underlying diseases. We want to convey our condolences to the families who have lost their loved ones. We also want to convey our appreciation to the staff that has done everything to try and save the lives of those of our people. May their souls rest in peace. And therefore, at this point, I would like us to move on, just to clarify as well for the public to understand that when we issue the numbers, at the moment they are not live numbers. They actually get calculated at midnight, and then we do the clearing of all the figures during the course of the day and doing all the reconciliations. So sometimes when you hear the reports, some people saying we've seen more patients than what is reported, there's just the lag that we do have to experience as we move along. When it comes to patients who are deceased, we wait for the full report. In some instances, we have to wait for postmortems, we have to wait for a full clinical report in terms of what has happened, and as well as a confirmation that the person did in fact have positive tests on COVID, and therefore we will find that there might be a bit of a delay in the announcements of death. But at the end of the day, we will have all of them reconciled such that we are able to report accordingly. Having said so, I'd like that we get the introduction of the experts that we have invited. Leading the team is Professor Salim Abdul Karim, who is the chairperson of the Ministerial Advisory Committee, which is a wide committee of about 45 people that includes about 20 professors from the various disciplines on health. That would be infectious diseases specialists, physicians of various descriptions, virologists, immunologists, microbiologists, epidemiologists, and a whole spectrum, including intensive care specialists, pediatricians, and so on. So this team basically meets and every now and again looks around at what is the experience on the ground and what is the experience on the research, and put together various guiding issues that must therefore guide the response of the health department. In there also are some of the health policy members from various parts of government who are here. So the presentation today is going to be given by Professor Abdul Karim, and then there will be commentary from some of the experts, and then we'll open up for questions. And of course, we hope that one day we'll be able to repeat this, but a bit of a new issue for us. May I just ask that we get the presentation of the specialists, if they can just be introduced briefly for everyone to understand the background from which they have come. Thank you very much, Chief of Staff.